My name is Stan G. I'm the president of the family group. I think you all received a letter that I sent out inviting you to today's meeting. I handed out, and there's more, if you didn't get a copy of the family group survey. We want to try to tailor programs of interest, okay? I'll go over this one, but other topics that you want the family group for the center to present or get speakers on, feel free to write it down. And also, if you would, put down what's a good time for you to attend? Afternoon meetings, evening meetings, just let us know that, okay? So you can fill out during the program, and there's more of these sheets on the table also if you didn't get a copy, okay? Let me mention why we chose this topic. And really, the board of the family group was discussing topics that might create some interest. And a lot of the things that we've been hearing about, the Justice Center, for example, okay, we don't know that much about, but it has an impact not only on, a good purpose for protecting, our loved ones, also has a side effect. It's really discouraging people from entering the field. So, and it's really based on how it's conducting business. I think the fundamental goal of the Justice Center is everyone could applaud, but how it applies that is something that we're concerned about, okay? So these are just one topic that got my attention, but there are other changes on the horizon. Those who get Medicaid service coordination, that's about to change under the regulatory environment. That's changing because of how it's being funded, okay? And the state wants to capture more federal funding. That's going to be funded by Medicaid, okay? Service coordination. You didn't think about it, but that's where it's going. So these are things that came to our attention on the board, and we thought some overview about these changing, I call it a changing environment. Funding, we all know everybody wants to cut back state and federal government programs, but they have impacts on how they provide care for our loved ones. And so we wanted to have the opportunity for the leadership of the Senate to tell you how they're dealing, coping with these major changes in programs that are ongoing and are coming, okay? And so that's really the main purpose of this meeting. The other purpose, this is a good opportunity, I think, for us to come together a little bit and hear from you about anything else that's on your mind that the family group can do for you, okay? So without further ado, the main purpose, the main speakers, I'll turn it over. Let me just mention that you all know Alan Crafton. He's our CEO of the center. He's going to talk, and we have Greg Sorrentino here, who many of you may not know, but he's very important to the center in not only keeping the programs going, finding the funding to keep our programs going. So he'll make a presentation too. So I'll turn it over to Alan now.
Thank you all so much for coming out today. It's a great turnout, and we're just thrilled about it. So, and I just want to make sure you know that this is really the family group's meeting, not mine and not Greg's. This is really a meeting, your meeting. And we're happy to participate and support this in any way we can. And very, very pleased that Stan G is now the president, chairman of the family group. And we're, again, trying to really develop it into as active a group as we can. And one of the thoughts we had was really to try to come up with, as Stan said, topics that would be of interest to you that we could be helpful with. And also trying to provide it at times that are good for you. So we're trying to do it at afternoon, night, afternoon, evening, to try to accommodate your schedule as best we can to be as user-friendly as possible. 90% of what we do comes from government in one way or another. So we do, I think, better than most, that we do about 10% of our own that we raise either through philanthropy or through our own business enterprises, that we raise 10% of what we do through those other means. So government's important to us. And no matter how much we try on the other side to I think, moderate against the whims and the cycles that go on in government, we're still trying to figure out that, that we still need to make our way with the government programs and how we're funded, how we're regulated, how we're, all those things that are tied to it. So that's an issue. And And I think Greg will get into some of that in terms of some of that, in terms of those kinds of issues. One of the things that's going on today is, I don't know how many people know of these various terms or heard these terms, but I have to actually read this now because there's so many new terms that have been put out lately that I'm having trouble myself keeping up with them. But you have individual support services, self-directed services, person-centered planning, workforce transformation, coordinated care organization, managed care, federally qualified health center, and there are more and more and more of these kinds of terms that are coming out. And as an organization, we have to make sense of this. We have to make sense of how this is going to impact us. How do we provide services in this environment, new environment? And so that's what our charge is. My own philosophy has been, my way of looking at this is try to, as much as possible, keep this transparent to you, that this would not be things that you would have to worry about as once you came into the Center of Services, that this would not be your worry, it's my worry, my staff's worry, our organization's worry, that we would take care of these things. But I think it's what's happened in the most recent last year, 2 years, 3 years, that these issues have become so pervasive and so significant that it's really difficult at this point in time to really just keep it away from all that stress and pressure and all that stuff away from you. So I think we've now decided, and really Stan G has been, I think, instrumental in this, that we've been really saying, look, we need to really have a conversation and explain ourselves to you a little better in terms of what exactly is going on. And so I think that's what this effort is, really, to try to lay some groundwork in terms of where we are, what the state of the center is, where we are. And in terms of our overall philosophy has really not changed. Our overall thinking is that we've always wanted to be a comprehensive provider of services, that we didn't see ourselves as a single service that families needed and required, and I felt the best way we could provide that is to provide a comprehensive array of services, not just one or two, but as many services we could to wrap around people, and I thought that was a better way in which we could help people. And so we thought day programs, not only in day programs and residential programs, but in terms of service coordination, in terms of health care. These are respite programs, advocacy programs. These are all the things that we felt was necessary to put together and integrate it, that we thought would be the best service for your loved ones, your children, your brothers, your sisters, and whatever your circumstance may be. And that's what we're after. We've also instituted some other things that I think were very creative. We've just recently launched an incubator that we're working jointly with a professor with RPI. He's a biomedical engineering professor, and we have 2 fellows, PhD biomedical engineering students who work for this incubator. And we're trying to come up with what I would look as views through the disability lens. And in my travels, I don't see a lot of research coming through what you all see, what I see, through the disability community. What are the needs that people have? Again, trying to be comprehensive. I left off, of course, one of the services we provide is education services, school services. I'm glad Karen walked in at that. I almost left that off. But it's certainly a very, very important service of ours. We also have a skilled pediatric center, which is also serves for babies and children who have cardiopulmonary issues that don't necessarily have cognitive impairments. And so we have a very large integrated service, and we are very committed to continuing with that thinking that is the best way to provide service, and that we think if you enter our service system, we have ways in which we can accommodate to you. So I guess that's just, again, my thinking on it, what our thinking continues to be, and what we work really tirelessly in terms of trying to promote that. Of course, this is about services to you and your loved ones, and we want to hear from you how we're doing, and ideas you have, or suggestions, or even questions if you don't understand some things that are being said to you or told to you, or things that you're reading or hearing about. Those are the kinds of things we'd like to be able to address, if not today, sometime into the future. So with that, I'd like to introduce Greg Sorrentino, who is the Chief Operating Officer, Chief Financial Officer Center. I've worked with Greg for nearly 20 years. I think it's really not appreciated enough how much Greg is involved in the actual provision of of the program services and how much he cares about it and how much he's involved in it, making sure that these services are delivered at the highest possible quality and level that we can provide. I think he has a lot of grit when it comes to that and fights tirelessly and advocates tirelessly for making sure those services are really there for each one of your loved ones.
Thank you, Alan, and hello, everybody. I'm going to try and take about 15 minutes and cover something that we could probably spend 15 days reviewing, but just a little bit of the things that we're trying to deal with on a day-to-day basis. And I'll go through each one individually, and I have a couple items I'll talk about on each one, but excuse me, I'm trying to put together a picture of where we are, some of our challenges, some of the things we're doing, so we can kind of, you feel better about how the center is moving forward. So when you look at some of the financial challenges to the center, and we talk, obviously staffing is first and foremost on all of our minds. Right now there's a 4% unemployment rate, as we all know, in the area. But on top of the 4%, we have to deal with the hurdles of hiring an individual that are important, but the background checks, the fingerprinting, PPDs, which are all, again, important. However, where it puts us behind the 8 ball is that's time. There's time to each one of those components, and that time is that someone else in this community is trying to hire that same individual in a 4% unemployment rate. So we're in no way critical of the the safeguards that are being put in place, but it's an extra hurdle for us that really is time is the biggest piece to that we have to try and get all these done in a professional way and be able to still get the individual hired before another agency or often cases now a retail environment or somebody else who does not have to go through these same requirements. So that's certainly a challenge for us. Information technology is, as you can see, I mean, everything we do now is centered around in some way, shape, or form. And we have come a long way, and we invested a tremendous amount of resources, both people, and Dan Shine is our Chief Information Officer over on the corner. But we've invested a lot of time and a lot of money in information systems and information technology. We can't invest enough to get to where we have to get to in this environment, but it's helped in our school program with the iPads and all the apps that are available. So, but all that's expensive to do all that. Then there's the inconsistent regulatory environment, which day to day for us seems to be another memo, another regulation, or another rule that's coming down. So, those are some of the things that, and we'll talk a little bit about them as we get further into this, but those are the things that really for us challenge us both financially and just operationally. From the clinic side, our frozen clinic rates, we operate a very professional and a very important healthcare clinic. And we operate in an environment that we don't get to negotiate with insurance companies and get rates differently. We're primarily funded through a Medicaid rate. Our Medicaid rates have been frozen. They were frozen really back to 1992. Then there was a different methodology that came out. Really didn't add any more money to it. Just kind of packaged things up a little bit differently. But we've done all these services in an environment where while all that was going on and our rates were all being frozen, healthcare costs were going up 10, 15, 20% a year. So it's put challenges on us that way. And then you have, we all go to a doctor and you almost expect now that they're not going to pull out a paper file and start writing your notes in there anymore. Everything's done electronically. We've invested a tremendous amount of money in an electronic health record. And really for the people we're serving, it's almost more important. There's many more medications and things that we have to make sure there's communication between the programs. But there's no funding for that. And we've done it, and we're slated to now, we have the health clinic up and running. We're now slated to look at residential and adult. So we're moving forward, but these are all done without any funding. And there's no dollars in the state budget for agencies like us to put technology enhancements in. So those are challenges that we have to deal with. Unfunded mandates, the Justice Center, which you've heard already today. Again, the background checks. A couple you may not know of, Legionella testing for the cooling towers in our commercial sites. Again, these are all important. Lead testing in our schools, that was elevated. Just those two alone add $15,000 a year in just testing, assuming nothing's wrong. But again, the state came out with the lead testing this past year and lowered the lead testing amount below the federal limit. So now you have a federal government saying the lead limit is acceptable at level A, and the state has now brought it a level down below that. So you may be in compliance, and then they lower the level, and you may be out of compliance. Particularly difficult in older buildings. I was talking to our facilities person that the old solder that you did on pipes in the past, 15% of that solder was lead. So just little things that come upon us, and these regulations get put out, and you have months to conform to them, and each one of them carries a price tag with it, and none of it carries a reimbursement back to us. And again, not that they're not important, they're very important, but they're just not funded. Rate rationalization. And really the biggest piece to that, without getting into the whole methodology, is to try and we used to be funded, and our rates used to be calculated based on us. So if we spent money in a particular program or invested in staff or did whatever, we got recognized for those dollars that we spent, however we spent them, and our rates were set up for that. Under this process, we no longer get looked at as an agency, we get looked at as a region. So, for an agency like us who tends to serve people on the far end of the care model, the rate methodology now puts you in with everybody else. So your salaries are compared to a region, and the region weighs heavier into that rate calculation than your own base pay does for your own staff. So if you're at the low end, if you have not been passing money along to your staff, you're actually going to make out in this process. You'll actually be a stronger agency under this process than the agency who has done the right thing over the years, taken the money they were given and reinvested it back in their staff like we did. You end up coming out on the short end of this calculation because it's a regional average. Everything's a regional average now. So just another piece that we have to try and deal with as an agency. And with all those things, how do you do it? Well, it just increases the pressure on fundraising efforts. And there's a lot of different things that I think we do as an agency that may not be, and I know are not, the standard in the area or the industry. But I used an easy one. Vehicles, the vans in the residences or programs, the buses that we operate every day, 1.8 million miles a year. We operate those under Department of Transportation regulations versus Department of Motor Vehicle regulations. And what does that mean to you? That they're more stringent. And so a DOT program, you have to inspect the vehicles twice a year. Where Department of Motor Vehicles, you have to inspect them once a year. So, when you have 85 buses and you have about 250 vehicles overall, it's a big difference between 1 and 2 a year. But we believe that that's just one of. I could get into electronic health records, another one, that we believe separate us from, and you as a family should feel comfortable with, that we're going to the higher standards in all these areas where we have the ability to do that. And understand that puts the money for that comes from our commercial operations and our foundation. That's where our fundraised dollars go, towards that difference between the standard and where we like to operate our standard at. As far as houses themselves, we last opened a house in 2010, it's 7 years ago. But it took us 3 years to open that one. So the reality is it's been 10 years since we opened a house. And now, last numbers I heard, wait list statewide is about 10,000, give or take. So, that's problematic for a lot of reasons. But for us in particular, one of the areas that shows up, and I think there's another slide here, it'll show up again, is as our aging population ages within the houses, you have people evacuation issues and things on the second floor. When you don't have any new beds coming into the system, it's hard to accommodate new people trying to come in and accommodate people who need to move from a situation that they can't live on a second floor anymore to a first floor. Just a lot of switching that goes on, and you have to do that within the existing bed structure. You don't get to add new beds on top of a 10,000 person wait list statewide. Sheltered workshop funding ending in 2020. Actually, I believe we had to stop it allowing people into the program, and Mary Kim is here somewhere. That was in 2016, right? Summer of 16. So it's been a few years that we haven't had anybody come into the program, and then the funding will go away in 2020. And that's tied in, honestly, with our commercial operation and our printing and our mailing, which we'll cover in a few minutes. And it threatens the opportunities to work. And that's something that we have really worked hard on here to try and find other opportunities. And that's why we grew our printing and our scanning and those other commercial lines that we're trying to do, because we want to make sure that we have a place for these people to have the opportunity to work while the workshops are starting to get defunded. And then there's the physical plant and vehicle replacement issues. And again, I talked a little bit about the houses, but the reality is two areas where we really got hurt in the physical plant side of it. On the commercial side, our commercial buildings, South Pearl Street, Manning Boulevard, Glenville, Prospect. There used to be a way for the state to pay you when you had major renovations. You know, we had a flood 2007, I don't know if you remember that, it was at South Pearl Street. That was a major flood for us, major damage. We had a way to go back to the state and get funding to help cover the cost for some of that. That's gone now, that doesn't exist anymore. And in the houses, we used to have a way to go there with a plan to keep the houses, if they needed roofs and driveways and boilers, the big items. Those are all gone. We now get $50 a month per person, per bed that's occupied, which for us works out to about $220,000 a year to cover everything that goes on in a residence. And that includes driveways and roofs and boilers and all the major expense items that go into caring for a residential program. So we have found a way to get around that. We have found a way to take that $220,000 and turn it into a financing plan, which allows us to at least double that a year. I think last year we put in over $500,000 of repairs to our buildings. We brought our own staff in to do the work so that we could schedule it better and do it at a better cost. But those are the little things that, again, we try and do to keep the properties looking and your family's homes looking the way they should with people living in them. And the same thing for our commercial programs and our sites that we operate programs on. Issues we want to educate you on. Be Fair to Direct Care, which I think I believe it's starting back up again right now with the legislature to try and get funding. We are very much in favor of getting more money for direct care. Absolutely very much in favor. We like to say that, be fair to care, because in our model, as Alan talked about, we need everybody. It's a team that cares for your family members. And so the program managers and the support staff and everybody that goes into making sure that your family members are cared for every single day, many of them are left off of that Be Fair to Direct Care campaign. So the funding does come in, but the state restricts the dollars to where they can go. And they take a lot of classifications of employees out of that, which creates compression issues for you have a direct care staff person and the person above them is not in that mix, and you keep moving the direct care up, you start to have, you have them bumping into each other from a salary standpoint. So those become agency funding issues to try and get, deal with the individuals who are not part of the Be Fair to Direct Care program. So again, we believe everybody should be in that. Supportive employment challenges, preferred source. So our mailing and print operation, we have what's called a preferred source, which in essence gives, when we bid on a contract for work, it gives us the ability to price in a workforce that may not be at the same level as who we're competing against in the community. And so it gives us a little bit of room to make sure that we can keep the individuals that we employ working. That's come under a tremendous amount of pressure. We need those jobs, and we need those dollars to fund these programs that we operate that are not funded through the traditional Medicaid setting. Service coordination, I believe Alan's going to touch on later in his presentation, so I'm going to jump over that for the coordinated care organization. I talked a little bit about the aging residential population and, again, creating evacuation accessibility issues. There's no money for us to do modifications or new development. Actually, it's not even the money for new development as it is even now the approval to do it. The modification side, I mean, we've done that in a few different homes. We have found ways to do that, but it's very difficult to get around some of the regulations that the state has put in. And then, you know, the state trying to create a managed care, and that's really what this CCO that Alan's going to talk about is around managed care. And probably the best way I can explain this for those of you who have been in this area for a while was the whole Berger Commission. Remember when they were trying to get the hospitals to work together? That was not done by taking money out of the system. That was really done by putting money into the system on the front end. Getting hospitals, encouraging hospitals to work together. And a number of them came together, a number of them needed money to either solidify their pension plans or be able to consolidate in and do different either renovations or do whatever they needed to be done to bring hospitals together. But the point of this is the money was invested on the front end. And by investing that money, you were able to get what you really needed out of the back end of it, which was a savings to the Medicaid system. And that's really the difference right now, and what we have seen is that there is no money being put in on the front end to try and convert our industry to managed care. But really, that's a really big distinction between what arguably was successful in getting a number of, even, let's look at our area alone, a number of our hospitals came together. Well, they came together with the front end money. And for the managed care to be successful in our industry, they have to really do the same thing. They have to be able to bring agencies together, and that does take some money on the front end. Staffing challenges, you know, this is really two parts. In staffing challenges, obviously we have an unemployment rate, it's 4%. Regulations, we talked about that, the pressures from the Justice Center, and I think Stan even talked about it in his opening remarks, or maybe it was Alan. It's not only the Justice Center itself, it's the threat of the Justice Center and how the staff are treated. Whether you even want to come into the industry or if you've been in the industry, whether you want to stay in it. So it's a combination of recruitment and retention. Minimum wage increases in other industries, so you have fast food now marked out to, what, $15 an hour in a few more years. That's our direct competition when those rates continue to move without the Justice Center. I don't think McDonald's has the Justice Center. Coming in January of 2018 is a change in the Family Medical Leave Act. And in essence, what this change will do is allow people to have the ability to take time off. You can even take time off in 2018 if you had a child born in 2017. That's mother or father, or actually both. So one can take time and then another one can take time, even if your child was born a year earlier. So those are all things that, again, there's no one in this room would argue that that's bad. The problem is in an environment of 4% unemployment, an environment of pressure from the Justice Center and all the other things we have going on, excuse me, minimum wage going up, and no more money coming into the system to be able to hire additional workers. So when someone is out, it's a real problem for us, not to mention the administrative cost of tracking a lot of the things that we're going to have to now track. Again, it's another unfunded mandate that's being passed down, and we don't disagree with the mandate, we just disagree with the unfunded part, as it really is going to create a lot of additional costs for us. But the bottom part of this is just so, you know, it's not woe is me, we're not waiting around for something to happen. The human resource staff and the IT staff have worked very closely together and created a new mobile app and a database that will allow us, we believe, to get to the front end of hiring, which allows an individual to go onto their phone, and it's tied in with social media, and it's got a whole bunch of components to it, but in essence, it'll allow you to, I think it's down to about 3 minutes. You can be on social media, you can see an ad, you can go onto your phone, you can get the application, you can get it filled out, all in under 3 minutes, then puts it into our system, at which point we can pick it up and start tracking it through. The applicant keeps up to date. There's emails that go out to the applicant, to the hiring manager, to the HR department, helps develop a database for us. I believe that kicked off today, correct? So this starts today here. And we think that's really going to help us in this environment of all the other issues to be able to recruit staff and be able to hopefully improve the staffing situation we have in a number of areas. And the other thing which we're really proud about is in all these other challenges we have, in 2017, we will invest about $5 million in raises and lump sums to our staff, which, again, we're proud to do that. They deserve that. And again, it's through planning and all the other things that go on that allows us to be able to get this money to be able to give the staff. And I think one of the things we're going to try and communicate to staff, I'd like to take 2 seconds right now and communicate with you is, we've been doing lump sum payments now for a number of years. And sometimes it's hard to explain to staff, why do I not get a raise? Why do I get a lump sum? And we keep trying to say, because things change on us faster than we can adapt to them. And then, so I have 3 memos in my hand, all coming from, I won't tell you what agency, but they're all coming from a large state agency who funds our day programs and residential programs. So the first one's dated October 5th. And it's this whole page talking about how the rates are out. They're all based on our 2015 costs and all this, all the different pieces to how they did the rates. So that's this one, October 5th. Same individual, 8 days later, writes another memo. It says, the purpose of this memorandum is to tell you there was a systemic error that was identified in the calculation of the rates, and that it affected every rate currently posted on their system, and they're working diligently to correct the error. Now, this is only $60 million of our budget. Then there's memo number 3. Same individual. November 6th. It says that now they will continue to engage provider representatives, to discuss how to better promote system sustainability and our efforts to update the rates from July of 17, which we still don't have because they were issued and then they were issued wrong. Now they're also going to engage Medicare and Medicaid services at the federal level to talk about possible alternatives. Following those discussions, we will reconvene a meeting with provider representatives to discuss possible options. We're in November. These rates are July of 2017. They were issued, they were wrong, and now they're going to engage everyone to talk about, I already told you how they calculated them, that was in the first memo. So this is what we deal with. Why can't you commit money in salary increases going forward? Because you think you're getting paid this, and then 8 days later you find out you're not getting paid this, and then a month later you find out you're not getting paid at all. We don't know how we're going to pay you. And these are all real. And so that's some of the challenges on top of all the other challenges in getting staff paid. So now there's good news. I got to throw all the other stuff. So in essence, really, we just wanted to, on top of all this, we do continue to grow. Your family members do get good care with us. We continue to grow our commercial operations through all those challenges and the printing and the scanning and all that to try and keep that job flow going and generate income to offset all these other things we talked about. There is a program, DISRUP, which is through the health department. and it's federal money. And what it's really trying to do is get the money's going into the hospitals, and then the hospitals are being encouraged to work with community providers like us. We've actually had some success with this, so it is working. But again, like we talked about a few minutes ago, the money was put in on the front end, right? They gave the monies to the hospitals on the front end to work with community providers, which is different than what they've done so far with managed care. So we're participating in that, and that's helping our clinic primarily, but is helping other programs. Alan talked about the Life Quality Solutions Incubator, and again, trying to come up with ways to improve quality of life. He talked about the federally qualified health center status, and what that does is allow our clinic to get access to federal funding, which is a little bit different than just straight Medicaid. We aren't even into this completely yet, but we believe there's ways that we can benefit from some pharmacy arrangements, which we're working on currently. This will be in a partnership really with Whitney Young, so it allows us to now partner up with somebody who we've been working in the same area for a long, long time and haven't really been able to do anything together. And then, so stay tuned on that. Our paperwork is finally in, and all the questions have been back and forth. And then the last piece is the growth of our endowment, which I believe is also later on, so I don't want to jump onto somebody else's stuff there. So that's it. I think we're doing questions after, I believe, so I'll.
Okay, so a lot of information, and we can try to go over some of it if we have some time to go over some of that. I did really want to spend just a few minutes talking about service coordination and care coordination organizations. How many people here have get service coordination? It's an important service. The state is now mandated to all people who receive service coordination, that now has to be done through these regional centers called Care Coordination Organizations, CCOs. The center has partnered with a number of other organizations to create Life Plan Care Coordination Organization New York, Life Plan CCO NY. There has been an incredible amount of activity around this. My view on this is that we should do what we do, and that's take care of people. And that's foremost and most important to me, that we make sure that whatever commitment I've made to you, I try to honor as best I can, and unwavering in that. And so what I look at in the care coordination, service coordination, the care coordination is that this organization, Life Plan, will basically keep your services seamless. That service will not change. And also, they're creating another level of care, calling it care coordination, which actually will have a little bit more of a medical focus. So not only you have the basic MSC, but also care coordination, care management. I am will be the initial chairman of this new plan. I am very devoted and committed to MSC, Medicaid Service Coordination, and Care Coordination, period, end. And we are going to be strong and do well with it because of the great work that's done with our MSC providers and our staff. We've always enjoyed much more inflow, and that's from all the organizations around the Capital District, more inflow to our services than outflow. And that's by a significant margin. And that's because it's the one area that people, families, have the right to choose what provider they want. And I've always been proud of this, that when it came to choice, you chose us. And that's what we want to earn that, and I think that's a good thing to earn that kind of service, because that's when you have better service, when you have to earn it. So I think that's been our hallmark, and what we really are committed and devoted to continue to see that happen. I want to make sure that people are cared for properly, and we don't disrupt people's lives. So we want to do it in a systematic, thoughtful, methodical way, and so we're after that. So that's my take on that. I also want to just really briefly go over some of the things we've done, and I appreciate this really with our family group, is advocacy, and something we really want to work harder on. I think Greg really put into some fair amount of detail why advocacy is important for us. And we probably could do better than what we have, and so we will. And we will work harder on that in terms of making sure that we have a voice in the way this world is going to be built around us. And we shouldn't just be sitting there and have this all dumped on us, but we should be able to have our voices heard also about what's right and what's wrong. And so I think that we want to strengthen that, and the way to start this is have the family group really rise up and be more of a potent voice. So I really do, again, appreciate Stan's help in this regard, as well as everybody else. And also with us is Karen Pass, a former chair, who was chair for a very long time of the family group, and so I'm very pleased that, and again, with the turnout here. We see you as families as our ambassadors, not only just for us, me, not for me, but for all our children, our loved ones, our family members. You're the ambassadors for that. I think that, again, look out for our staff. So Be Fair to Direct Care, I think, is great. And as Greg said, it really is be fair to care. But we certainly want to make sure that if what we have to do is argue exclusively for direct care, we'll certainly do that. But really, it's about care. It's not just direct care, it's care. And a lot of things go into care. And so we want to make sure all that's funded, not just a little piece of it. So the legislative work, we also have, the family group has also been a leader in the state in terms of guardianship. We have our own corporate guardianship for families, that if their circumstances are such that they need a standby guardian or somebody to help look out for their loved one, then we're able to do that, which is really a wonderful service. We've been working very hard on philanthropy, and as you heard, it's something we have to continue to do more on. And it's not just about fundraising, but it's about philanthropy. And philanthropy is more of a planful. I think it encompasses everything. Not only does it encompass fundraising, but it also encompasses planning. And so we've been working with our boards of directors. We have a number of them, and we've been working with them, and we've been working with families to be thoughtful that they can look at into the future whether or not they'd want to be participating in our philanthropy program, Legacy Gifts. And we have a number of people here who have already done that. We're very grateful for it, and thank you for your leadership in that regard. But really is what it does, it plans for our future. That if we can build a large enough endowment, we can build a large enough fund into the future, that we can take care of some of our own here. So we've been really working hard on this. We've listed out a number of the things that we've purchased with this. We've done work with our residential program. We've put on porches and things like that really aren't necessarily in the core of, I guess, health and safety, but mean everything to what your person's life is and quality of life that they have. So just being able to do things like that, little kinds of additions that we can do to a home that we do because we have the ability to do it, and we have the flexibility to do it, so we do it. And so it makes a huge difference. We have staff recognition and tuition assistance programs that make a difference. We have programs we do in recognizing our staff that's solely funded by the family group. And these are recognition programs that mean a lot. That comes from you. That comes from your help. It's a way to say to somebody that your work is meaningful and we care about it. So it's great. We have arts programs, dance programs, music programs, really are funded by us. That's not funded by government, it's funded by us. Those programs are our initiative, those are our innovations. That's all made possible by your generosity and your support. And also the general fundraising and philanthropy that comes to the center. We have something called MOVE equipment. I don't know how many people are familiar with MOVE, but it's movement via education. And it's a way to get people up out of the wheelchairs, up out of bed, and get them up standing and moving. And it's a curriculum that we have that we think is just wonderful. And so we've been investing in that heavily to make sure that we can do that for people and do that on a regular basis. Again, that's funded by us, not by anybody else. Communication devices. We have a pool down at Langen School that we renovate, we upkeep it. That's us, that's nobody else pays for that. The pool looks better than ever. It's just beautiful. It's a great, and many of our students are, as part of their IEP, that's what is required to be in the pool to help them with their physical issues that they have, and it's just been a tremendous program for us. And then we have other things for individuals with Down syndrome, and certainly our center healthcare operations. So just a number of things that we do through the flexibility, really. Well, I should say not just with the philanthropy, but really through our commercial operations that we're able to do these kinds of things and to reach out and do a little bit more that makes the texture of living and working and going to program here that much better and enhanced. And lastly, I'm very proud of this, that we have now Our endowment, as of 2017, is now crossed over $5.5 million. That's an endowment, a gift that will keep going in perpetuity. And so we have the money that spins off is what we spend on the center and center activities. And that's something that we really believe we can be $10 million in just a few years. And so we have actually we've had almost $3 million committed in planned gifts already to the center. And many of you, looking around the room, see some of the people who have really done that. So we have $3 million is not counted in that number. I do think it's a way of being thoughtful, planful, and ways in which people can help in ways that they didn't think they could help, but that makes a huge difference to us and to your family members. In a world of really constant change, we want to be constant in that. And that the one place you can rely upon is us in this environment, that we will continue to do what we do and do a really good job with it and be as caring as we've always been. And we're not going to go anywhere. We're immutable to these changes. We have to deal with them, we have to react to them, but we're immutable, that we are going to continue doing the things we do and stand up for really what I think, if we don't stand up, who will? So I think that's one of the things that we will continue to be a hallmark and continue to do. And that we will continue, as what our tagline says, is to help people get better at life. It says everything about who we are and what we do and what we try to do. And I think it says in very few words, and I love that. So I think the quote's a great quote. Imagination gives you the picture. Vision gives you the impulse to make the picture your own. And so, again, I thank you all for coming out. It's really great seeing such a good turnout.